Hi, I'm Dr. Leslie Wakefield with Wellsprings Health, and today in our Spotlight Series, I am with Ayelet Gottesman. She is a certified personal trainer and a mom of three boys, but the work that she does is a little bit different. She specializes in pelvic floor, just like us, hence the connect. She does a lot of pre and postnatal fitness. She works with perimenopause and menopause, PCOS. She does a lot of corrective exercise and strength training, and you're starting to see why we love her and why there's a lot of overlap for our patients. Um, Isla, you are an avid proponent of resistance training for women as a foundation for health. And I love that. I'm a big believer myself. Can you introduce yourself and tell us how you got into this?
So when I was 6 weeks postpartum, first of all, hello. Hi. Thank you for that awesome intro. When I was about 6 weeks postpartum with my second, I basically had my 6 week post birth, post delivery checkup, and I was told, you're good to go. You want to do jump roping? Go do jump roping. You want to run? Go run. So, as somebody who had done yoga, even though I was in the process of getting certified for strength training, I just jumped back into kickboxing because why not? And I actually had zero gap and I opened up my diastasis recti. I opened it up doing that and I developed all sorts of symptoms like pain with sexual intercourse, a lot of discomfort when I was going to the bathroom. And I was just wondering why that was the guidelines. Like, why was I just checked and told I could do things without giving any, like, even when they picked me up off the table after checking me, they picked me up with their arm and I crunched up without any coordination or anything. And I was like, wondering like is this is this a baseline or is there something that we could explore and help women who feel like they're living with discomfort that's normal because they had a baby like actually live a higher standard of life. So I decided for myself because I couldn't afford to get the help I needed and I didn't have any resources that I would deep dive, and that's what led me to where I am right now.
So you were studying it for yourself because you had your own issues and you
Yeah.
didn't know where else to go, basically.
No, I was actually told to drink a glass of wine before intercourse and that to try again, see what happens.
I thought I was going to stop hearing that 10 years ago, but I still hear it.
Listen, he just turned 5. That specific kid just turned 5 in December. So we're still, and I've heard multiple people come in with the same stories. It's just like this repeated tagline, like, you had a baby, that's what happens, you know?
So, how do you describe your work then to people that ask? Because you're a personal trainer, you do progressive resistive exercise, and but you work with women specifically for particular goals. How do you describe that?
So it's a big melting pot, but I think that if you look at it in any way, like if you're just doing strength training, then you're kind of missing the point because the goal of strength training is to build the body and become strong. But if you're trying to build the body and the pelvic floor is dealing with all sorts of levels of dysfunction and you're totally neglecting that part of the body, you're just going to build on like a very shaky foundation. You might end up even worse than before. That's why I often send you guys clients because sometimes it's out of my scope. And I'm like, okay, this is something that you need to see. But there are some things that are within my scope that I could help with. So I try to take a holistic approach to it. We do a lot of corrective exercise. I do postural assessments. I treat them nutrition also. And we try to treat the picture as a whole.
The holistic perspective.
Pause. Did I even answer your question?
Yeah, I'm not pausing. That was great. Keep going.
I was like, wait, did I go off? Was that the call? Could you repeat the question again?
It was perfect. How do you describe your work? And you totally answered it. What I'm hearing, if I could repeat back to you, just to make sure
Mhm.
I'm picking up what you're putting down, is you are a personal trainer, meaning you take people through exercise within your scope. So, not necessarily
Yes.
pathology like we would see in physical therapy, but people with a particular set, like a body, a whole person
Yeah.
body
Whole body.
is never perfect, right? We all have our
Yeah.
issues, but the people you work with, you focus on women that have women specific issues and you take them through exercise, but with a whole person lens. And I say it that way because that's the way we do it. So that really resonates with me.
Yeah.
You cannot dissect one system out of a person's body. You can't, as far as we go, you can't just take
Yes.
the pelvis out, treat the pelvis, plug it back in, and say the person's good to go.
Wouldn't that be nice?
That'd be great. That'd be so much easier, but no. Um,
Yeah.
And then from you can't just be like, "Okay, strap on a kettlebell, we're gonna build a glute." Just
Right.
maybe 2 if you want to, right? It doesn't work
Which
that way.
side do you prefer?
Yeah,
The right or the left?
you've gotta work with a whole person and a whole body, and I love the way you talked about a foundation, having the pelvic floor as a foundation, and if you don't have a solid core, and for me, the pelvic floor is part of the core, then you're building on that shaky foundation.
Yes, exactly. I actually see a lot, and this is something I'm sure that you're also starting to see is a lot of women that are getting the sling surgery then, and they're getting the sling surgery and it's like a band-aid that was put on the symptom, but then 5 to 10 years later, they come in, they're like, "I had sling and now I'm starting to leak again. I don't understand," because the system itself wasn't necessary. There are certain circumstances where the sling is 100% necessary, but if you're not gonna treat and follow up with, like, understanding pelvic floor coordination, pressure management, fixing thoracic kyphosis or this way, like, then there's gonna be newfound pressure that's gonna continue that's gonna pop up eventually. You can't just sew it up and call it a day, and I
Can I
think that
Can I put that in
mhm,
layman's terms just for everyone trying to
yes,
follow you on that? Because 'Cause you're so right. So a sling procedure, the one that you're talking about, is for a little bit of prolapse. It's like to help lift up the bladder or the urethra, and
right,
that's a lot of times given to women who have a little bit of leaking, like with coughing or sneezing. And it can work because it's changing the angle of the urethra and it's offering a support. But
right,
I think to your point, the real question is why is that angle of support change? Like, what is happening with the pressure that's coming down into the pelvis that's making the system leak a little bit? And if you don't change that whole system that ended up causing the leakage, that little bit of support over time is probably or maybe going to wear out.
exactly, yeah,
It might not last as long, and so we love the sling if that's necessary for the
yeah.
person, of course, but people, I believe, should be doing therapy first so that you know if it's
Yes.
necessary because you might clear up all the problems without ever having to do a surgery, and then if you do have surgery, then come see us after, right?
Yes.
So that we can make sure the surgery sticks and lasts, and you don't have to go back in again down the line, maybe when you're older and less able to recover.
Yes. But also when you have and this is how I like to look at, like, all things related with any corrective exercise, postural deviations, pelvic floor issues. If you have this, like, almost like reason to come in and fix it, right? Pause, right? Let's like figure everything out. Like, why are you going to treat that one aspect? You have an opportunity now to rebuild and get the knowledge that you need and the help that you need to really live a long life with like a high quality of life, feeling good and strong. Like you're okay, so your pelvic floor, you're leaking, right? This is an opportunity to build up your back muscles, your glute muscles, the whole posterior chain. You could be lifting like your grocery bags without help when you're older, just because of that silly little teeny tiny leak that didn't really bother you so much, but that you decided to look into, you know? It's
And
an
so much more than that.
opportunity.
You're build with by working with you, by doing resistance training, I'm a huge fan of resistance training for women. They're building bone density, moving into menopause and beyond,
Exactly.
reducing fall risk, right? Which is probably
Hip fractures.
the number one fear, of everyone past a certain age is what happens if I fall,
Yes.
right?
Yes.
And
And it's a valid fear if you're
it's
not
super
actively
valid,
trying to counter that.
right? And all of that can be a cardiovascular health, osteoporosis, fall risk, all of these things improve with exercise. And
Yes.
a lot of women are intimidated to do resistance exercise because they've not been exposed to that before. So
Right.
I love the way you put that. Okay, let's say you have a little bit of leaking, but can we use that to get started, not just to fix the leaking, but really to rebuild the system with that strong foundation that we were talking about from the beginning and all the other benefits that women can reap from that.
Exactly. And I think if you're not looking at it from that angle, like if you're not looking at it as a whole, it can feel very like scary to inch into. But if you're like, wait, this take a step back, this is such a huge opportunity to change my quality of life. It's so exciting and it's so much fun. Like I have so many people that come in and they're so scared. They're like perimenopause or postmenopause. They're so scared to like even hold like a 10-pound weight. And I'm like, your grandson is literally 50 pounds and you carry
All
him
day
no
long.
problem. Yeah.
Yeah.
I'm like, this is gonna be nothing. And then within a few months, they're like so shocked that what? I'm deadlifting like 75 pounds. I never thought I could. And all of a sudden their whole lives change, like the opportunities they have. are all different. I could go on a hike. I could spend time with my grandkids. I can relate to more people. I don't feel old. I feel young. I'm living the great life, you know? And it really changes how they even enter those perimenopause, postmenopause years. Their symptoms get like way reduced. That was in English. Their systems reduce a lot.
I like way
Um, so trilingual, it comes and goes. Sometimes I'm like translating. But yeah, it's an awesome, all of it is an awesome tool. And when it's all used together, it's super powerful because you can't put on muscle without knowing proper nutrition to support that, you know? And I feel like when you combine it as a whole, which you guys do a great job of doing, is yeah, amazing. You're giving women freedom for the rest of their lives.
I love the way you reframed what could be a really scary problem and you turned it into such an advantage. And that's a wonderful perspective. I think that I don't know how many patients agree or disagree, or your clients agree or disagree, but I think as an approach to life in general, I think that's quite lovely. It says something about you.
It helps you kind of like take the fear out of what has to be done. You know, like, also, like, even I'm sure you see this all the time when you're dealing with pelvic floor issues, you're like, you can't look at it just the pelvic floor, so you're looking, like, the head to toe, right? And you're like, "Oh, this is a little bit could be worked on, this could be worked on that," and it's like, "That's so overwhelming, like, I have so many issues wrong," but it's like, no, because these little things all contribute to that one thing, and how exciting we get to get strong at all those places also, you're gonna feel amazing by the time we're done, you know?
You work on one and you're working on the whole system. You can't take a piece out. Anything we do to improve one area will carry over and overflow into everything else. Yeah. All right. So I'm going to play devil's advocate for you and give you an opportunity to respond. Are you ready?
Uh-oh.
Because
Hit me.
you're talking a lot about building muscle, and you clinicians are talking about all of the benefits of building muscle, but I don't want to look too big. What do you say to that?
Oh my god.
No, no, no,
Okay.
no. Real concern.
It totally is a real concern. It I hear it because if I'm being honest with you, before I went into strength training, I was super concerned because I'm like a little thin girl and what am I gonna look like when I put on muscle, you know? Like
Because
what's that gonna look
you
like?
are nobody know you are quite petite,
I'm
right?
very small. Yeah, my body weight percentage is crazy low because I have PCOS and I struggle to put on weight. So by the way, muscle, when you hack the system with PCOS, which is one of my biggest clientels, and you figure out finally the formula to put on weight, which I figured out, all of a sudden putting on muscle equals better sleep, better hormone regulation, better everything. So I would say number one, for most people, they have to decide that, okay, say I were to put on muscle, right? Is a better quality of life like worth it or is it better to be miserable for the rest of my life? That's number one. I had to get through that and decide I cannot live this way anymore. Like I have to get serious because I want to be playing with my kids when I'm older and I have goals and ambitions and I don't know if I could do that if I don't. So that's number one, the mental factor. But number two, do you know how hard it is to put on muscle? If it was that easy, we would all be jacked. I mean, look at all the gym guys who spend years showing up and drinking, what is it, like gallons of milk and 8 eggs with every meal. Like you have to be
With
so
so much more
calculated.
testosterone than women have access to, by the way. Just
Also true. Also true.
and
That's
many
also
of you are taking exogenous testosterone, taking
yeah. Yeah.
supplementing your testosterone also, right?
It's not all kosher. But those people work so hard, it's their whole lives. Like, honestly, even me, at one point, it was, like, coming from I think I was 99 pounds when I started building muscle because my body would not put on weight unless it was muscle, and it was my full-time job was putting on muscle. Like, all I could think about was every 2 hours getting adequate amounts of protein, and I was trying to bulk. Most people don't have the time or energy to spend that much time during the day doing that. It's not realistic.
Yeah, and I think for women especially, we have this idea that if we lift the 10 pounds, it's too heavy and I don't wanna build muscle, but to your point, all right, but we're carrying the groceries and lifting our kids and the car seat and moving the furniture around all day long. And also, I think people have the misconception that adding a little bit of muscle through resistance training will make them look bulky. And the reality is actually muscle is compact, right?
Yeah.
Muscle is compact, and especially for women with our natural testosterone levels as they are, it's gonna be very difficult for most women to get bulky. And
Right.
muscle, it's more compact than fat, and through resistance training, I explain to people, "Listen, you might look smaller, actually, not
Literally.
that's not necessarily depending on the goal of the person and why they're working out, that may or may not matter to them, but it's
Yeah.
quite difficult for a woman to bulk up, without
Yeah.
as really making it their full-time job and supplementing and doing all these other things."
Yeah, and it's funny because most people, what they say when they start putting on muscle, at least like from the people that come into my gym, and I would say with a highlight on the menopause women, they all, I would say 100% of them, that's a huge overstatement, but the ones that really are following nutrition, not trying to bulk, just regular nutrition to put on muscle, all of them will say, wow, my clothes fit me so much better. Like I'm wearing a dress that I wore 5 years ago that I couldn't fit into this year, and it's like big in certain parts. And that's with putting on muscle, which is literally counter to the claims that you see everywhere about toning. But toning is low, like leaner body fat and putting on muscle. It's like what everyone wants. Don't you want to feel good and look good? Don't like, yeah,
And resting metabolic rate, which is like the amount of calories our bodies use just at rest, goes up with more muscle mass. So,
there you go.
I hate to tap into the aesthetic component, but that's motivating to most of us to a certain degree. You will burn
100%.
more fat by having more muscle. I mean, while you're sleeping, you'll
100%.
be burning fat.
Yeah.
And I find that just sprinkling a little bit of that in really helps turn the tide for a woman who's on the fence about like recognizing the health benefits, but it's a lot of time. I mean, potentially. Because if
Yeah.
someone's never worked out before, the idea of training 3 hours a week, well, let's go back to that. Before I make
Okay.
a What do you recommend for resistance training to your clients as, like, a time investment that they would need to do?
Is it like from starting beginning, let's say?
Yeah.
Or okay.
Let's say you have somebody coming in, they've never resistance trained in their life, but they hit menopause, their metabolism crashed, their hormones are all over the place, and they're trying to build healthy lifestyle to move through menopause.
So I would say as the starting point for resistance training should be at least 3 times a week. I don't love putting like a time on it. If they're coming to me, it's by default an hour. But I don't like putting a time on it because it like you could finish your workout if you're lasered in and focused in 45 minutes or an hour. I don't really care as long as you lift it to failure. So I like to say at least 3 times a week for starting, and to divide it upper body, lower body, full body. And then as they progress, if they have more like athletic goals or specific aesthetic goals, when they're like reaching that intermediate point, I would say sometimes a fourth, like an extra session and divide it a little bit differently. So they end up being even shorter workouts four
So
times a week.
for somebody that's never exercised before, that can sound like a lot.
Yes.
Maybe to someone who, let's say, did sports in high school, like, "Oh, girl, I used to train 2 hours a day, 5 days a week. That's nothing."
Right.
But everybody's coming from a different place, and
Yeah.
I think noting all of the benefits of resistance training, including the aesthetic, including the health, including mental health, um, all of that's important depending on, who it is that we're suggesting it to.
Right. But you know, it's funny. My favorite clients that I have are all perimenopause slash menopause because they, first of all, they do have more time on their hands. They're not running after little kids, but they are super, super motivated. They're like 3 hours. That's it. Of course, I was at doing Pilates an hour every day, or I was running an hour every day. And now you're telling me it's so much less time, but also they are feeling the effects of not doing it. And they're like, wait, we need to get serious now. Now it's time to get serious. Everything, like I'm here, I'm lasered in, I'm focused. Whatever you need from me, I will do. It's a big shift. It's better to
Okay.
do it now than later.
So you mentioned that population being like after the running around after kids' years, but I know you also do a lot of work pregnancy and postpartum.
Yes, a
So
lot.
what does that look like? How is that different?
So it's a little trickier because not everybody has the time that they need to do it, right? And recovery looks different. But when I have people that come in, first of all, I always have a client assessment where I'm able to, like a pelvic floor assessment where I'm intake form where I'm able to basically like scan and screen for anything that I think they might need to see you for, which is why I end up referring a lot of people to you.
Yeah. At that point
But
specifically, you've literally told me, listen, they came for training. but I'm not gonna proceed until they've been cleared by pelvic
Yes,
PT. Yeah. So
because it's so
you're very
important.
careful in that way.
Yeah,
And it's
listen,
great, honestly.
there's things that are in my scope, and then there's things that are way out of my scope, and then there's things that I'm not comfortable even, like, engaging with until I know from you that it's a safe green light. Because
Mhm.
some things you can only see from an internal assessment, which I don't do.
Yeah.
So, it's very important to be able to be open to that and sending people because you're not gonna do them a justice by, like, pretending you can help them even though or thinking you can help them without getting concrete, like,
Yeah, because
data.
resistance training is can be intense. It's a load on the body. There's a
Yes.
there's a concept in exercise called progressive overload, meaning you have to, you know this, I'm just talking to people listening, continuously, carefully, thoughtfully, but overload the system just a little bit to get it to respond. So it's a stimulus response of progressively overloading. And if there is a medical issue or something else going on, you really want to know about that so you can tailor
Yes.
a routine around it or get it taken care of first.
Yeah. So that's the number one most important. Also, usually with my C-section girls, I'll request also that they go and check just in case because even just like the adhesion stuff, that's out of my scope. So I'd like you to look at that usually. Um, but for the ones that don't flag for anything specific and they might flag for symptoms that can align with like having a weaker pelvic floor or having a tighter pelvic floor, um, what the session would look like would be like 30 minutes of breathing. I have 4 different breathing progressions that I do with them. A little bit of core work. It progresses as we continue. And then 30 minutes is strength training with a mix of corrective exercise because I also do a postural assessment. So I plug in the postural stuff into the corrective exercise to strengthen and help support their healing through postpartum and through pregnancy and postpartum so
That's
that they could feel like
beautiful.
really good and actually get progress.
Yeah, I love that. That sounds amazing. Sign me up. I'm coming. Put me on your
Just
schedule. I need
it's
half an hour of breathing and corrective exercise for sure.
I know it's actually a fun combination because it's not they don't leave so depleted even though they are lifting to failure because the 30 minutes first of all, most of the breath work, as you know, the diaphragmatic breathing, it stimulates the vagus nerve, so it promotes a sense of calm, it helps build lung capacity, there's so many benefits. They're getting, like, a big bang for their buck, and they get to rest, you know? It's hard being a new mom. It's hard being pregnant.
All right. So, what else? Let's put a bow on it. Wrap this up for me. Anything else you want to share about yourself or your work that you do with women?
So I think in general, looking at the woman body as a whole, including like hormones, training for, different like PCOS, Hashimoto's, menopause, perimenopause, like taking advantage of where your hormones are at in order to build for the future, longevity, building a strong foundation that's not shaky, taking few steps back before jumping into the few steps forward makes all the difference in the world.
Mhm.
And that's the approach I always love to take. And honestly, I'm not promoting myself. I'm moreover promoting you than me here, but it's expensive sometimes, but the cost of not getting seen postpartum or when you're pregnant or after is so much more expensive than going in and taking care of yourself. I know moms, we all have tight budgets, but that little you're not gonna remember that amount that was spent towards you feeling better, but your kids will feel it long run and now, and you will feel it. And everyone benefits from just giving themselves that little present and just pausing and doing it in the moment instead of waiting until there's a real problem that's way more costly and hurts and took away years of your life 10 years later.
Yeah, absolutely. The ounce of prevention being worth so much more.
Yeah, and also you learn more about like we weren't taught about our bodies. We were taught biology, but we weren't taught about our bodies. And going through this journey teaches you so much about your body. And I truly wish it upon everyone.
Thank you very much. Well, I'm going to include access to you in the notes and any links you want to share. I'll make sure to include that. Thanks so much for your time. I'm sure I'll be talking to you soon.
Oh yeah. Thank you for having me.